morning all. My name is Tanya Dean and I'm an optometrist. Today I'd like to talk to you about loss of vision or blindness or visual impairment. It is described as loss of the ability to see anything, including light. One can be completely blind or have a partial visual impairment. Cases of blindness are on the rise worldwide, and these are attributed to several factors and causes, such as age and disease among others. Globally, almost 1.3 billion people are living with eye problems and some form of visual loss. Those with distance vision account for 188.5 million people regarded to have mild vision impairment, while 217 million people account for moderate to severe forms. Sadly, 36 million people are blind. A population of 826 million people have near vision problems worldwide. In the United Kingdom, approximately 2 million people have problems with their vision, while 360,000 are registered as completely blind. The number of blind people is still on the rise, and it is approximated that soon more than 2 million people will be diagnosed with some form of blindness. Causes of blindness vary, but susceptibility to loss of vision can be heightened by various risk factors. These include age, certain health conditions like diabetes, and freak accidents. It is worth noting here that people of a lower socioeconomic status are also more at risk of loss of vision. In the UK, the leading risk factor for loss of vision is advanced age. Life expectancy in Britain is high, and the rates at which age-related macular degeneration blindness is increasing is alarming. According to the statistics on vision loss, 1 in every 5 people who are 75 years old and above have been diagnosed and are living with blindness. In people who are 90 years old and above, the risk increases to 1 in every 2 people. Other risk factors include gender and people living with learning disabilities. Women are more susceptible to experiencing forms of sight loss than men, while people who have learning disabilities are at a greater risk than ordinary people. Other causes of blindness in the United Kingdom are poorly controlled diabetes mellitus, glaucoma, and cataracts, among others. Blindness can be classified into many groups, but majorly as partial and complete loss of vision. According to the World Health Organization, it can also be classified as near vision blindness and distance vision blindness. In partial blindness, an individual can see things to some extent, while in complete blindness, the patient is unable to see anything, even bright light. In the United Kingdom, blindness is classified according to severity, and they are 3 classes as follows: severely sight impairment, and low vision. In severe sight impairment, the affected individual is unable to see objects at 3 meters, as compared to a normal person who can see things up to 60 meters. Their central visual acuity is less than 3 out of 60 with normal visual fields. Those who are sight impaired can see at 3 meters something that a commonly sighted person can spot at 60 meters. Still, it is considered less severe, and in most cases, such people are not usually included in the National Blindness Registry. In the low vision, the individual has visual acuity lower than 6/18 and is not allowed to drive. This is due to the problems they have recognizing faces and other details that are across the road. Other forms of blindness include color blindness and legal blindness. In color blindness, an individual is unable to distinguish colors, whereas in legal blindness, a person is only able to see within 20 meters instead of the required 200 meters for an average person. Signs and symptoms of blindness include poor night vision, feeling of eye cloudiness, plus an inability to see shapes or shadows. For infants, they may present with eye redness, constant rubbing and hypersensitivity to light, white pupils, continuous production of tears, and abnormal alignment of eye or movements after 6 months of age. Diagnosis is made through comprehensive history taking, physical examination, and use of Snellen's chart, among others. Most of the causes of eye problems like cataracts and refractive errors are preventable. Hygiene is also an important aspect of preventing blindness. Treatment options include correcting the refractive errors, treating any bacterial infections, and surgical corrections. Use of contact lenses and corrective glasses can also help people with low visual acuity or sight impairment.